A study on effects of education program for cognitive rehabilitation. Dr. Youngsun Park, Dr. Youngju Zi. Introduction. The proportion of the population aged 65 or older in Korea is increasing annually since 2013, when the value was 12.2% and is expected to be more than 20% in 2026, making the Korean society to reach a super-aged society. The dementia is a geriatric disease that causes the greatest social and economic costs in this aging society. Dementia, a brain disease, is a complex clinical syndrome that causes continuous damage to the entire brain function, including problems related to language, comprehension, judgment, and behavior, as well as memory, and widely affects the personality, thinking, judgment. With the family nuclearization and the increased participation of women in economic activities, the situation and responsibilities for supporting the elderly in the home are gradually weakening, and the voice calling for the responsibility of the government and society for the elderly support is increasing. The nursing care for the elderly with dementia, therefore, has become a problem that is not affordable at home, and responsibility for caring for elderly people with dementia is shifting from home to community or facility. As the importance of prevention and management of dementia at the national level has been emphasized, a dementia center of each local government and regional dementia support center have been established to build a systemic and comprehensive dementia management system. These centers, which consist of experts, are responsible for the prevention of dementia and the burden of dementia families through elderly prevention and early screening and early intervention for dementia patients. In addition, facilities for community living elderly and patients with dementia and a service delivery system within the community are established, and health professionals are trained and released. In addition, many facilities and communities are seeking to provide quality services by securing scarce manpower by utilizing volunteers is increasing. The dementia knowledge and positive attitude toward dementia, therefore, are important for effective dementia management for health professionals and volunteers who provide care for the elderly and patients with dementia. The study of education to enable them to take care of elderly with dementia more efficiently, however, was very limited. The purpose of this study was to evaluate the effects of educational programs for cognitive rehabilitation provided to health professionals and volunteers on their dementia attitude and self-efficacy for nursing elderly. Method: design and subjects. The subjects of this non-synchronized study to test the effect of educational programs for cognitive rehabilitation on the participants' dementia attitude and self-efficacy for nursing elderly were 15 volunteers who registered at a volunteer center in Gyeonggi-do and 11 health professionals working at health education institutions. Majors: the general characteristics of subjects such as gender, age, education, economic status, and motivation for participating program were directly asked. The dementia attitude referring to their knowledge of, sense of, and behavior toward dementia were measured by the Dementia Attitude Scale DAS developed by Carpenter and used in survey on dementia prevalence. The self-efficacy for nursing elderly was measured by the inventory of geriatric nursing self-efficacy, IGNSE. And geriatric attitude was measured by Korean version of the Geriatric Attitude Scale, GAS. Data collection. The educational program for cognitive rehabilitation was provided for 5 weeks once a week at a volunteer center located in An City, Gyeonggi-do, and a daycare center located in Y City, Gyeonggi-do, from July 20th, 2018 till January 13th, 2019. The program time per session was 7 hours. Data were collected before and after the intervention program, respectively. Educational program for cognitive rehabilitation. The purpose of the educational program for cognitive rehabilitation used in this study is to allow volunteers to provide effective care for the elderly and dementia elderly by providing them with the dementia knowledge and coping methods necessary for the prevention of dementia and dementia care for the elderly and patients with dementia. In this study, the educational program for cognitive rehabilitation sessions were provided 5 times, 7 hours for a session, once a week for 5 weeks. The theoretical contents included the types of dementia and coping dementia care and gentleness, dementia elderly and elderly long-term care insurance system, cognitive function evaluation, and readers' qualities. The contents for prevention of dementia included factors for improving brain activation and games for prevention of dementia. In addition, the opportunity to experience the elderly with dementia was provided through on-the-job training. Data analysis. The collected data were analyzed using SPSS Win18 program. The general characteristics and variables related to education were analyzed using descriptive statistics. Real number, percentage, mean, and standard deviation. The test of homogeneity for dementia attitude and self-efficacy for nursing elderly were analyzed using Chi-2 test and t-test, and the comparison between pre- and post-intervention and between groups in dementia attitude and self-efficacy for nursing elderly were analyzed using t-test. Result. Effects on dementia attitude and self-efficacy for nursing elderly. The analysis of the effects of educational program for cognitive rehabilitation shows that the mean score of dementia attitude increased in both professional and volunteer group, though that did not reach statistical significance. The score of self-efficacy for nursing elderly increased non-significantly in professional group while decreased in volunteer group. Conclusion. This study evaluated the effects of educational programs for cognitive rehabilitation provided to health professionals and volunteers on their dementia attitude and self-efficacy for nursing elderly. The mean score, the self-efficacy for nursing elderly, increased statistically significantly, both groups, suggesting that the knowledge about dementia was improved and the stability in caring elderly with dementia increased. These results indicate that the proposed educational program for cognitive rehabilitation is effective in making both professional and volunteer groups to provide efficient care to elderly and patients with dementia. The results for score of self-efficacy for nursing elderly showed no significant change in both groups, though it increased slightly in professional group. The decrease in score of self-efficacy for nursing elderly in volunteer group is a concern to be considered in developing program. It is recommended, therefore, that it is necessary to develop and supplement the educational programs for the volunteers participating in caring elderly and the patients with dementia, and to recruit more various groups in replication study.